Ever have one of those awkward moments when a business disappointed you? You got ripped off? Didn't get what you expected? The Better Business Bureau can help you avoid these uncomfortable situations. BBB accredited businesses are honest, ethical, and reviewed annually by the BBB. Don't experience another awkward moment with a bad business. Trust the ones that operate with integrity. Look for the BBB seal. It's the sign of a better business. And find a better business anytime at bbb.org.
Well, thank you so much for joining me, Crystal. I appreciate your time. So we have Crystal with First Alternative Care. So give us a little background about First Alternative Care.
Well, First Alternative Care is unlimited telemedicine, available in all 50 states nationwide, 24/7, 365, for $35 a month. And that is for 9 people.
Awesome. So that's really cool. It definitely offers an alternative to, like, especially if your company doesn't offer insurance, it takes like the headache out of, well, what do I do if I don't have insurance? And it sounds like you guys provide a great alternative for that.
Absolutely. It's available to anyone. So citizenship and pre-existing conditions are not a concern. Anyone can use this.
Awesome. Perfect. So I know you've been BBB accredited, but how long have you been BBB accredited?
Well, I'm not sure if it's over a year or coming up on my second yet.
Okay.
So right in there.
Awesome. So what brought you to the BBB community?
Well, I had been utilizing events and different types of venues to circulate my name and my word, my business, but I found that there wasn't much traction. But having the Better Business Bureau logo has made some folks look twice. You know, when you have that logo on your materials, the use of that, it does lend that assurance.
Absolutely. And especially with, like, now in 2022, consumers more than ever are looking for businesses and organizations that they can trust. You know, we've seen a lot of scams, a lot of terrible things with, you know, unscrupulous businesses. And, you know, we definitely do appreciate you taking that time and effort to have the sign of a better business, that you're committed to our 8 standards of trust, that those are standards that you as a business owner, but also that your business stands by. And
Absolutely. Transparency is so important. If a business can't trust what it is you bring, then how will they conduct business with you? So
absolutely. And then kind of, you said you guys are in, your business represents all 50 states, regardless of citizenship. So that's really great, because I know a lot of people, that's an issue for them. Like, they can't have access to healthcare if they don't have citizenship, or even sometimes too, like, say for example, like when I go to Colorado next month, like if I'm traveling to Colorado and, you know, something should happen, sometimes insurances don't cover, like, once you cross your respective health insurer's state line, it's like, sorry, that's on you. And you guys offer something that alleviates that stress, because that is something that I worry about as a consumer, but I'm sure not only myself, but even families, like, what happens if they're doing a cross-country trip and God forbid something happens. And, you know, First Alternative Care thankfully has those resources where you don't have to worry about, is my insurance going to pay for this? What's my deductible? You know, all those questions that run through our minds when dealing with insurance, and it can be a huge headache.
that's very true. It's also true of the health insurance situation at the moment. I know that there are hundreds of thousands of people right now who are losing their coverage because it had come from the COVID era. So they had they had coverage in an emergent situation for loss of employment, but now they don't have the employment back, and neither do they have the insurance. So that is something that is of concern as well. Many people are losing their coverage because COVID coverage has lapsed.
Mhm. I know, and COVID is still out there, and it's not going away. And we kind of just have to move forward and just kind of live with it. And it's part of our day to day now. And it is stressful. Like you said, like those COVID safety programs are now gone. And it's like, what do consumers and also businesses, like what do
What
do
can
you
they offer? Right.
Yeah. And how can they stand out? And first alternative care does provide those resources and benefits. And
Absolutely. It is independent of any type of employment. So if someone wanted this type of coverage, which you can use at length, you can use it as much as you want. It is unlimited, but it is not employment dependent. So you can have this with you regardless of where you work or even if you work.
Okay. And that's amazing, because a lot of people, like, sometimes they have those employer backed insurances, but like if you change jobs or if you leave, like, yes, you still have that till the end of the month, but what does that look like for the new month?
Exactly. It's a big concern. And what happens if you move from one state to another? What can you do then? You're stuck looking, you're starting from scratch. What can you do in the meantime? Absolutely. This is for you. This is for everybody.
Mhm. And you said there's no like restrictions, there's no what's the word? You mentioned it earlier. I'm sorry.
There's the
pre-existing conditions.
Right.
Yeah.
So it doesn't matter if you have a pre-existing condition or not. So the typical ones we see a lot are diabetes, asthma, COPD, hypertension. These are pretty common. And
Mhm.
most folks just need to see a doc long enough to get their prescriptions filled. You can do that with this. You don't have to worry about anything or whether or not you're going to be eliminated because you have an existing condition. You're not, and anybody can be seen.
Awesome. That's great. Because yeah, I know that's one of the things, like when you are looking for health insurers, like sometimes, those things come up and then you have higher premiums or, this, that, or the other.
And it's such a hassle. When you call, you try to get someone on the line or get a question answered, and you just can't. And
yeah.
with First Alternative, if you have a question, call the number. People answer the phone. You will not be in voicemail jail. I cannot stand that. I have to have a human answer the phone. And so that happens, but also First Alternative Care offers a feature that no other telemedicine offers, and that is that there is an advocacy center. So you have unlimited access to an advocacy center. So if you have insurance and you're not sure it's working properly for you, or you got a big bill, something is questionable here, call them. They will walk you through it. They will show you if you're getting the right everything you can out of your insurance, or they'll walk you through your bill. If you have a problem, there's a question, there's charges you don't understand, they can help you get those charges reduced, even mitigated, even removed. So that is a feature no other telemedicine is offering, and it's also unlimited, just like everything else with First Alternative Care.
And honestly, that's really amazing, because sometimes, like, when you do get those insurance bills and you're looking at it, and of course they do the breakdown, but it's like, well, I don't know what all that means. Like, it's almost like you have to be a medical professional to really understand. Or
Unfortunately, yes.
Yeah, or even just like no medical insurance billing. And it's like the average person doesn't understand that. And it's like you just see the dollar amount and then the total, and you're like, oh my gosh, that's crazy. And
I'm going to go bankrupt looking at this. And most bankruptcies are medically bill based. So please, if you're looking at this, don't struggle with your medical bills anymore. Have an advocate. $35 a month for unlimited urgent care, but 60 or 90, depending on which primary care you'd like. You can have the advocacy center back you. You can call them anytime from anywhere and go over those bills, go over your insurance. Is it actually working for you? Is it worth the money you're putting in?
Absolutely. And I love that it's so affordable, because when I think about it in the grand scheme of things, I'm like, you said $39 a month, correct?
I said 35.
35. Okay, gotcha. Yeah, and I think about that and I'm like, well, if I go to Starbucks like
Mhm.
a couple of times a week, I've already paid for that in itself. And
It's less than a tank of gas.
yeah, and right now, yeah, that's super affordable and it provides you access to healthcare that you may not have even known existed. And especially like with telemedicine now, like that's such a big part of healthcare now. And even trying to find those resources like through your insurance provider, sometimes it's tough. Sometimes they only cover a percentage, all of it, might get some of it, but but with first alternative care, it takes care of everything, which is great.
It does. It does. It takes care of anything you can take care of uh, via video like this. And so the kiddos too. The kiddos can have the coverage. There's also unlimited behavioral health. So when you have the need to see a behavioral health, you want a mental health day, you want to talk with a counselor, you can absolutely do this from the convenience and privacy of anywhere you want to be, because it's on your phone. So if you want to do this on your lunch hour from your car, you can. If you want to do this from the privacy of your home, you can. No, this doesn't go, none of this is on the radar. This is not going to be reported back to your insurance. It's not going to be reported to anybody. It is your private information that is HIPAA protected by law. It has to be. And anybody can use it. So if the kiddos need a mental health day, there's something going on, the school went into lockdown and the kids are confused, you want someone to have them talk with them, absolutely, you can do that. Just like myself, when I experienced the loss of a family member, I lost my sister. And so this was very handy for me to use, handling that and processing all of that comes, because you just don't know what's going to happen from one day to the next. It's nice to have this little reassurance in your back pocket.
Absolutely. And yeah, you never know what can happen even 15 minutes from now or even tomorrow. And thankfully, First Alternative Care takes that stress away. It helps ease people. And it's awesome that you're providing that service and benefit to consumers, but also businesses who can benefit from it.
And we do have the availability to businesses. It costs nothing to set this up with your business. When you set up with the business, you can then make this available from your business to your employees. However, when they leave, they can take this with them. It is not employment dependent. It is not. And if you are a business and you'd like to set this up, I can say that there's no babysitting. You don't have to make any payroll adjustments. You don't have to pay anything. I can explain to and educate your staff, your employees, or your client base, and they can utilize this on their own. They can call myself for questions if they have any problems. They can also call any of the phone numbers that are throughout the website. So if they have a question, they can call the home office. They're going to get a person, someone who can listen to and respond appropriately to whatever questions or needs.
Awesome. That's so great. I love that. It sounds so silly, but I love that you can actually connect with an actual person, because so many businesses or organizations that you call and it's automated, and then you're having to press numbers or repeat yourself, and it takes so long to even get to an actual person if you ever do. And yeah, it's like I said, it sounds silly, but I love that you can actually contact a real person, whether it's you or someone else. They can
Absolutely,
Yeah.
absolutely. It's very important that you can reach out and speak with another human being, regardless of what you're calling. If you're calling behavioral health, if you're calling the advocacy, if you're calling the home office, if you're calling me, absolutely. And I'm right here in Albuquerque, so you can get me anytime. We can connect in any fashion that's easiest for you.
Kind of wrapping up, was there anything else that you wanted to share about First Alternative Care? And like you said, you represent its coverage for all 50 states. Um, Citizenship is not an issue. Um, Anything else that you would like to share about First Alternative Care?
Well, there are three ways you can utilize this. $35 a month. 9 people can use this unlimited from anywhere they are. So if I have a membership here in Albuquerque and I've got 5 people in West Virginia that want coverage, I can put them on my account. They don't have to be family and they don't have to be here. They can be anywhere in the 50 and Puerto Rico. So if you've got family out in Puerto Rico, that applies too. Anybody, your 8 people. So I have the membership, I can add 8 more people. So, and that's no cost. Everybody can use it unlimited. It's $35 a month for just the urgent care. So if you want just the urgent care aspect, you can have just that. We also offer primary care in the form of individual memberships. So just the single person, just me, or the group. So the primary membership, that's me plus 8 more people. So that's urgent care plus all the bells and whistles, the mental health, the dermatology, the advocacy center, all of it. And yes, prescriptions, x-rays, labs, MRIs, CT scans, all of that can be done here. Any prescription can be filled and any lab work can be done, and your annual labs are free.
Awesome. That's really great to know because prescriptions that's a big one that people always worry about if it's going to be the manufacturer costs or if it's going to be, those are the ones that people worry about.
The prescription program that I offer is $19 a month for the individual. It's $29 a month, I believe, for the group. So individual or family, group, whatever, it doesn't have to be kin. But when you sign up, there's 3 months worth of maintenance medications. So like your statins or your insulin, this kind of thing, whatever it is, the first 3 months are free. And
Wow.
then the following months are going to be anywhere from 50 to 90% off. So please, please don't pay full price for your medications ever again.
Absolutely. That's great to hear, especially with prescription costs. They can be so small or they can be outrageously large. And
I was quite infuriated when my EpiPens went to $1,000. I could not believe that excuse me, an EpiPen, that is life-saving medication right there. And you're going to tell me it's now out of reach? I disagree strongly with that.
No, totally agree. Well, thank you so much for spending time with us this afternoon. It was great getting to know a little bit more about First Alternative Care. And then we can definitely share this with our accredited businesses, and we can definitely have them reach out to you if they have any questions about First Alternative Care. And, hopefully, we get to work together some more in the future.
That would be lovely. I am available. I'm right here in town. If you have any questions, just look me up, reach out to me through the Better Business Bureau, or you can find me on Instagram, Twitter, or Facebook, either under my name or First Alternative Care. So my name is Crystal Chesak, and my company is First Alternative Care. So you can find us in either of those places. You can also find us through the BBB, and just reach out to me and I'm happy to help you. Like I said, setup is free. It takes very little time, and the hardest work about setting this up is fill in the blanks. So I hope that's not too tough.
Well, thank you so much, Crystal, for spending your afternoon with us. We will definitely reach out.
Thank you so much. It was so good to see you, Austin.
Yeah, thank you.